Cardiovascular disease claims more lives than all forms of cancer combined. Of the 1 million people who will suffer a heart attack this year, nearly half of them will have had no prior symptoms or warning signs. Today is National Doctors Day, when our guest wants patients to get ahead of their heart health. His name is Dr. Eric Serrano. Good morning, doctor.
Good morning, Mary. Thanks for having me on.
It's nice to see you. Exactly what is National Doctors Day, and what's the idea here?
Well, National Doctors Day is a day to celebrate the contributions that physicians make. And if you have an excellent physician, today's the day to call them up and tell them how great they're doing. It would mean the world to them. And today I would like to add my own contribution, talking about heart health with people outside my own practice.
All right, let's start maybe with cholesterol. Is that a point where patients might, it's kind of toe in the water, I'm going to start learning how all of this works? Is that one of those good indicators?
We're finding time and time again, study after study, decade after decade, that cholesterol is simply not enough. 50% of patients who have heart attacks have normal or treated cholesterol levels. You remember Tim Russert?
Of course.
Yeah, so Tim Russert, he had passed a stress test about a month before he died suddenly from heart disease. And, fortunately, we have other simple blood tests that may help find people who are vulnerable for heart disease, including looking at inflammation in the blood.
I've been reading more about that. So can you test for inflammation, and just how much of a difference does that make?
In my MD-VIP practice, we check for inflammation in the blood every year, and we know that if it is elevated, it actually can identify people who we otherwise tell are not at risk for having heart disease. So it's very important to check.
What are the key factors in determining risk, and are they different for women and men? We've been learning more about that in recent years.
Yes, we keep changing the rules on our patients, and we're finding that the traditional risk factors aren't enough. We continue to try to identify more and more markers that can be helpful in identifying people at risk. So the classic example is someone in their middle-aged who goes to their physician, and the physician tells them that their cholesterol is normal and they're maybe overweight or normal weight. And some of those people have no warning signs, like you said, or any symptoms prior to having, unfortunately, an event. And some people die suddenly.
How closely should we look at family history when it comes to heart disease?
Family history is important, but there are some people who don't have a family history and still have heart attacks. So, and the point that you bring up in terms of men and women, we're finding that women they have symptoms that aren't completely typical. So men may have chest pain, and some men and women can have chest tightness, pain in their upper body, in their back, and their arms, neck pain, jaw pain. So if you have any concern, obviously calling 911 or calling your physician is very important.
A bit of a change of direction here in the conversation, and that's the idea about practice size. What's your take on that? Some are smaller, some more conventional, a little bit bigger. What do you prefer?
Well, yeah, I definitely prefer a smaller patient size. Since joining MD-VIP, I've been able to spend more time with patients. I have a cap of 600 patients, whereas the traditional model, they have 2,500 patients and are focused more on sick care just for time purposes. I'm available same day, next day. I'm available 24/7 by my cell phone. Patients can call me directly on my cell phone. They can text me, email me. So we have no wait in our waiting room. So if I see a patient coming in from the parking lot, I even hold the door open so they can come right in.
What makes a difference? You're talking about access and having a strong relationship with your doctor. All of those things are important. Give us one website, and then we'll let you go, doctor.
Yeah, to find a doctor like me, you can visit mdvip.com. There's also some more information about heart health there as well.
Sounds great. Dr. Serrano, thanks for your time today.
Thanks for having me, Mary.